Bismillahirrahmanirrahim. Assalamualaikum. My name is MOHAMAD KHAZI. I'm from RASHID 2433B. Okay, now I will explain to you about the special test that I have done. That is MOHD test for knee injury. Okay, for the first slide, I will explain about the anatomy of the injuries. There are 3 bones that need to form our knee joint. Okay, first is femur, that is our thigh bone. Second is tibia, which is shin bone, and the third one is patella. Between our femur and tibia, there are 2 wedge-shaped pieces of fibrocartilage act as shock absorbers known as meniscus. This MOHD test is used to determine the presence of meniscal tear within the knee. So in this picture, I show that meniscal tear that located between the femur and the tibia. Now we move to the categories of meniscal injuries that have 2 types. The first one is acute tear, which is usually occurs when the knee is bent and forcefully twisted while the leg is in a weight-bearing position. The second type of meniscal injuries is degenerative tears, which more common happen in older people. And the degenerative tears may result from minor events, and there may or may not be any symptoms present. Okay, now we move to the mechanism of injuries. First, mechanism of injury is an acute twisting injury from impact during sports, and it usually happens when the foot stays fixed on the ground and the rest of body rotates. Next is getting up from squatting or crouching position. Third is lateral rotation of the femur on fixed tibia may tear the lateral meniscus. And the last one is an ACL injury often accompanies a medial meniscus tear. Okay, now I will explain about the procedure of the special test, which is MOHD test. Okay. We have 2 types of MOHD test. The first one is for medial meniscus. Okay. The patient should be lying supine and then grabs patient's heel with one hand and another hand placed on the knee joint. After that, make the patient's knee full flexion, and then passively externally rotates the tibia, and then extend the knee in order to test the medial meniscus. And now we move to the second types of MOHD test, that is for lateral meniscus. The procedure is same with the first one. That is, patient should be lying supine and then grabs patient's heel with one hand and another hand placed over the knee joint, and then make the patient's knee fully flexion, and then passively internally rotates the tibia, then extend the knee in order to test the lateral meniscus. Okay, for the last slide, we explain about the do and don'ts for the MOHD test. Okay. The do and don'ts for the MOHD test is don't rotate the tibia so much that can cause hip rotation, so that you have not isolated the knee joint. And also, we need to be careful with this test, as if there is an existing cartilage tear, because we don't want it to be too firm and to make it worse. Okay, next is for the equipment. We don't need an equipment because we just do by using our hand. Okay, so now we move to the video of demonstration about the two types of MOHD test. That is for medial meniscus and lateral meniscus.
Assalamualaikum warahmatullahi wabarakatuh. My name is binti AZHAR from class RSR 2433B. Today I'm going to do the knee special test for PCL, which is the posterior drawer test. Anatomy of the PCL, which in long term is a posterior cruciate ligament. PCL is the strongest and largest interarticular ligament in human knee and the primary posterior stabilizer of the knee. It comprises of two functional bundles, which the first one, the larger anterolateral bundle, which in short ELB, and the smaller posteromedial bundle, PMB. The size of the femoral attachment of the ELB is nearly twice the size of its tibial attachment. Common injuries of PCL. It can be pain, swelling, and instability. Pain. Mild to moderate pain in the knee can cause a slight limp or difficulty walking. Swelling. Knee swelling occurs rapidly within hours of injury. And instability. Your knee might feel loose as if it's going to give way. Injury most often occurs when a force is applied to the anterior aspect of the proximal tibia when the knee is flexed. Hyperextension and rotational or valgus stress mechanisms also may be responsible for PCL tears. Injuries may be isolated or combined with other ligamentous injuries. A PCL tear can result in varying degrees of disability from no impairment to severe impairment. Grade 1 is the PCL has a partial tear. Grade 2, the ligament is partially torn and looser than in grade 1. Grade 3, the ligament is completely torn and the knee becomes unstable. Lastly, grade 4, the PCL is damaged along with another ligament in the knee. Lastly, the do's and don'ts while performing posterior drawer test. Do sit a little bit on the toes of the tested extremity to help stabilize it. Make sure the patient is on a supine position, which all parts of the patient's back is laying on the floor. And lastly, don't put a full force while doing this test to avoid any further injuries. Noted that while we're doing this special test, we don't need any equipment. And that's it. Thank you.
Assalamualaikum. Hi, my name is IZZAD KAMAL, and now I'm going to explain and show you the special test of knee injuries for iliotibial band syndrome called OBER test. Okay, anatomy of the iliotibial band syndrome. Iliotibial band is a thick band that runs on the lateral side of the thigh and insert at the knee. It composed of fibrous connective tissue and appears from the tensor fasciae latae and gluteus maximus muscle. Iliotibial tract covers the lateral femoral epicondyle and expansion to the lateral border of the patella. It helps stabilize the knee through its range of motion to make flexion and extension movement. Okay, now we move to the mechanism of iliotibial band syndrome. Iliotibial band syndrome typically is due to the overuse of the connective tissue of the thigh bone at the knee joint. It increases the tension or friction of the iliotibial band in this area can result in an increase of irritation or inflammation. Muscle weakness or the heat adaptation is also be associated with the iliotibial band syndrome, as this causes increased hip internal rotation and knee abduction. It causes pain and tenderness in those areas, especially just above the knee joint. Okay, firstly, the patient should be in the side lying with the affected leg at the side up. Okay, then stand behind the patient and firmly stabilize the pelvic. Grasp the distal end of the patient affected leg with your other hand and flex the leg to a right angle at the knee. Next, extend and abduct the hip joint. Then slowly lower the legs toward the table, abduct hips until motion is resisted. Ensure that the hips does not internally rotate and flex during the test, and the pelvis must be stabilized. Okay, now we move to the do and don'ts for this open test. For do, you must ask the patient if they have any pain before proceeding with the special test. Then you must gain consent to proceed with the examination. You also must make sure that you stabilize the patient hips area to make it effective. For don'ts, you do not force the patient too much as it will make the injury worse. And you must ensure that leg is not internally rotate. Okay, the equipment that we need to make the special tests more easier and effective is treatment table.
Hello, my name is MOHAMAD SYAKIRIN bin SHAFIE. I'm from RSR 2433B, and now I'm going to explain about the clock test. This test is also known as the patella green test. The purpose of this test is to detect the presence of the patellofemoral joint disorder. For example, the patellofemoral pain syndrome, PFPS, also known as the runner knees, anterior knee pain, and the patellofemoral joint syndrome. Next, we talk about the anatomy of the injuries. The patella or kneecap sit at the front of the knee. The quadriceps muscle come together and attach at the top of the patella. The patella attach to the front of the shin bone via the patella tendons or patella ligament. It plays an important role in acting as a lever system for the tight muscle. For the mechanism of the injuries, imagine that this is your femur bones and this is your patella. Actually, patella sit in a groove and move up and down like this. But the patellofemoral pain syndrome occurs when the patella rubs on the femur bones underneath like this. So this is how this injury happens. Next, the common injury for the patellofemoral pain syndrome is the sport that involve running or jumping, such as track, basketball, volleyball, cross country, and football. For the do and don'ts, number one, the amount of the pressure applied must be carefully controlled, as the more pressure can elicit positive response even in the normal individuals. Number two, the best way to do is to repeat the procedure several times, increase the pressure each time, and comparing the result with those of the unaffected sites. Number three, do not apply this test when the patient is unconscious. And the last one is make sure there is no open wound around the knee. For this test, it's only use the physiotherapy examination table. Lastly, I want to show you the procedure of the clock test.
First, the patient is lying supine with the knee relaxed and extended. Next, the examiner places the web space of the thumb on the superior border of the patella. Third, the patient is asked to contract the quadriceps muscle while the examiner applies downward and inferior pressure on the patella. Pain with the movement of the patella or inability to complete the test is positive sign of the patellofemoral dysfunction.
Good afternoon to everyone. Okay, my name is ENJA. So today I will explain to you a special test for knee injury, which is anterior drawer test. Alright, before I explain to you how to conduct of this test, okay, first I will explain the common injury at the knee joint, which is patellar instability. Okay, patellar instability is occur when the kneecap slip out of where it is sit in the knee joint. Normally, the kneecap glides smoothly in this groove, allowing it to attack in a straight line. Okay, some people refer to this condition as patellar dislocation or unstable kneecap. Okay, most of the patellofemoral pains is feel in the front of the knee. Okay, next, the mechanism of injury, symptom and reason. Okay, the symptom of patellar instability is the patient will feel knee pain, swelling, clicking, barking or rocking sensations at the knee, and appearance of the kneecap slipping or sliding out of the knee joint. Okay, and the reason is the patient will underlying conditions, overuse, excess weight, and their muscle imbalance or weakness. Alright, next, do and don't while we conduct this test. Number 1, apply this technique or test when the patient get injury. Number 2, don't bend patient knee more than 90 degrees. And number 3, don't pull patient knee too hard. Okay, to perform the anterior test, bring your patient hips to 45 and your patient knee to 90 degrees of flexion. Okay, the test is positive if the tibia translates interiorly more than 6 ml or if you experience soft and mushy and feel. Alright, that's all explanation for anterior drawer test. Thank you.
Hi, Assalamualaikum. My name is SYAHZULFAKRI bin RASHID. I am from RSR 2433A. So today I will explain about the valgus stress test. So let's go.
So, what is the valgus stress test? The valgus stress test is a test for damage to the medial collateral ligament of the knee. It involves placing the leg into extension, with one hand placed as a pivot on the knee, with the other hand placed upon the foot, applying an abducting force. An attempt is then made to force the leg at the knee into valgus. If the knee is seen to open up on the medial side, this is indicative of medial collateral ligament damage and may also indicate capsular or cruciate ligament laxity. Next is anatomy, knee injuries. The knee joins together the thigh bone, shin bone, fibula on the other side of the shin and kneecap. Second, the knee is a synovial joint, meaning it contains a fluid-filled capsule. Third, participation in sport and recreational activities are risk factors for knee injury. A direct blow to the knee is serious injury and requires immediate medical attention. And lastly, the knee is the largest and most complex joint in the body. For the common injury at the injuries, an MCL injury is a sprain or tear to the medial collateral ligament. The MCL is a band of tissue on the inside of your knee. It connects your thigh bone to the bone of your lower leg. The MCL keeps the knee from bending inward. You can hurt your MCL during activities that involve bending, twisting, or a quick change of direction.
For example, the MCL can be injured in football or soccer when the outside of the knee is hit. This type of injury can also occur during skiing and in other sports with lots of stop and go movement, jumping or waving. Then, typical mechanism of injury. The MCL is most commonly sprained from a direct blow to the outside of the knee. The MCL may also be injured with an excessive outward twist when the foot is planted on the ground. This is seen more commonly on surfaces that have increased friction like artificial turf and courts. The procedure of valgus stress test. First, the examiner places one hand at the outside of the knee, acting as a pivot point, while the other hand is placed at the foot. The medial joint line is palpated while the examiner simultaneously applies an abducting force at the foot and valgus force through the knee joint. This test is typically performed at both 30 and 0 degrees of knee flexion. Performed at 30 degrees, the MCL is more isolated from other medial joint structures with an sensitivity of 86 to 96 for MCL test. This can be followed by performing the second version of the test at 0 degrees or knee flexion, which allow for assessment of other medial joint structures. The two versions are summarized below. First, knee valgus at 0 degrees. Along with the MCL, the medial joint capsule of knee, anterior cruciate ligament ACL, and the posterior cruciate ligament PCL are stressed. Second, knee valgus at 30 degrees. The MCL is prime stabilizer in this position and is therefore the primary structure assessed. The medial joint capsule is also stressed in this position. So, this is the valgus stress test, do and don'ts for the procedure.
For the conclusion, all these tests need to do in the correct way to give the correct result, and must keep in mind that this test cannot give confirmation for the patient that have that injury, but we need to perform this test for early diagnosis. Thank you.